As we age, routine health screenings become more common, and in many cases, they help us catch problems early. But did you know that some medical tests and checkups after age 70 might actually do more harm than good? Today, we're talking about 5 health checkups seniors should reconsider or avoid altogether, not because they aren't helpful in some cases, but because in many older adults, they can lead to unnecessary anxiety, risky procedures, and even harmful treatments. Let's explore these with care and clarity. 1. Routine colonoscopies after 75. Colon cancer screening is vital but routine. Colonoscopies after age 75 can be more risky than helpful. Why? Because the risks of the procedure, like sedation complications, bleeding, or bowel perforation, increase with age, and studies show that for adults with average risk, the benefit of continued colonoscopies drops significantly after 75. Instead, many doctors now recommend stopping this test after 75, unless you have a strong family history or ongoing symptoms. Talk to your doctor about switching to less invasive tests like FIT or stool DNA testing if screening is still needed. 2. PSA testing for prostate cancer in men over 70. PSA testing checks for prostate cancer, but in men over 70, it often leads to false positives, anxiety, and unnecessary biopsies. The U.S. Preventive Services Task Force advises against routine PSA screening for men over 70 because many prostate cancers grow so slowly they'll never cause harm during a man's lifetime. Treatments can cause serious side effects like incontinence and sexual dysfunction. The better approach: focus on symptoms and overall well-being. If you're not experiencing issues, ongoing PSA testing may do more harm than good. 3. Frequent imaging for mild back pain or joint aches. We all experience aches and pains as we age, but getting an MRI or CT scan too quickly, especially for mild, non-serious joint or back pain, can lead to unnecessary treatments or even surgery. Here's the truth: most imaging findings in seniors, like bulging discs or arthritis, are normal and often unrelated to pain. Instead of rushing to scan, try physical therapy, gentle movement, or conservative care first, unless there are red flag symptoms, like loss of bladder control or severe neurological signs. 4. Cervical cancer screening pap smears after 65. For women over 65 who've had normal pap smears for many years, continuing cervical cancer screening is usually unnecessary. In fact, continuing pap or HPV tests after 65 in low-risk women can lead to unneeded follow-up procedures and discomfort, with very little added benefit. If you've had 3 normal pap tests in the past 10 years, or 2 negative HPV tests, you can likely stop screening altogether after 65 per major health guidelines. 5. Full body scans without a medical reason.